Hello and welcome to Mountain Health Today, a program brought to you by the Tahoe Forest Health System and centered around your health and healthy living. Our guest today is Mr. Harry Weiss, President and CEO of the Tahoe Forest Health System. Harry, good to have you with us again.
Thank you. Happy to spend time and share with our community.
Harry, we've shared on this program some rather heavy topics in the past. Today we're going to talk about something I believe to be rather uplifting, and that's your Grateful Patient Program. And not a lot of people may know about that program, particularly those that have perhaps never been in the hospital environment. But tell me about the Tahoe Forest Health System Grateful Patient Program.
We're really thrilled to have started a Grateful Patient program, and it has many ways to access it. But what it does do is it gives our patients and their family an opportunity to really acknowledge excellent, high quality care, to honor those caregivers and the departments that served them with either a very challenging illness or injury. And it just really builds a very special bond between the patients and our caregivers. Our caregivers deeply love every person in our community. We wanted a new way that we could connect and dialogue and build additional friendships. And then in addition, if a person wanted to express that thankfulness via gift, that we have convenient ways to do that relative to a gift as well. And the backdrop of all of this, it's a very humble space that our entire team works within, and that is next to our families. Timely access to great healthcare is the most precious gift on this earth. Every person will experience some time in their life where they have difficulty breathing or unbearable pain. And it's at those times they perfectly prioritize what's number one, number two, and number three. And we're happy that we're here to be in those life-saving moments for patients in our community. And that's why we set up this Grateful Patient Program.
Harry, how specifically are they connected with the program? Is it something that occurs when they are an inpatient? Is it at discharge? Is it after? How do they access?
We have little cards, trifold cards in pretty much all areas of the hospital, where whether you're visiting in one of our clinics, whether you're in an outpatient a department of the hospital or an inpatient, you can acknowledge it that way. Or our nice website, you could click on make a donation, and there's an opportunity to tell your story about your appreciation for the care that you received, and acknowledge individuals there, because we'd like to hear your story. So you can make that connection with us through any component of our health system.
And Harry, I would imagine that response numbers are fairly high. It might not always be the case with some systems out there, but do you have a sense for A, the type of responses that you're getting, and B, the level of participation?
Again, it's a relatively new program. We've received many amazing commentaries from patients, and we try to share every patient's story back with the team of caregivers, physicians, etc., so that they get to hear that feedback. And it's very inspiring to our team that's so devoted 24/7. So yes, it is amazing. It's very uplifting. As you can imagine, there are many stressors as our team is focused outward in an unselfish way on our patients, but there's many stressors that our team feels every day.
And in terms of management of the program or care of the program, that's conducted by the foundation?
Correct. We have a Tahoe Forest Health System Foundation based here in Truckee, and we have an Incline Village Community Hospital Foundation in Incline Village. And we have this Grateful Patient Program set up at both locations. so that patients in each region can work closely with our foundations.
And I have heard that the foundation is very caring and and wonderful to work with for our past patients that access the program, correct?
We really enjoy building these friendships, because being in healthcare, it's all about building friendships, whether you have a significant healthcare need now or not. And that's what our foundations are about. And so we look forward to making these acquaintances with our public so that we can invite you to different events to share with you the great progress our teams are making to treat various illnesses, or new programs that we need to start to fill a gap that's in high demand in our community. We've added different physical medicine programs. We've added mental health programs. We've added new varieties of pieces of equipment. So that connection with our community is so vital for us to continue to bring these new programs to our community.
And that is a good spot to end. We're going to take a break. We're with Harry Weiss, Tahoe Forest Health System, talking about the Grateful Patient Program, and we're going to be back in just a minute. Welcome back. I'm Ted Owens, the host for Mountain Health Today. You've been watching a conversation I've been having with Harry Weiss, President and CEO of the Tahoe Forest Health System, about the Grateful Patient Program that the health system has designed. Harry, we talked a lot about the testament to the appreciation your patients feel for the care they've received. But with respect to the Grateful Patient Program specifically, why does it matter?
It really is an opportunity, first and foremost, for patients to share their gratitude verbally. And we found through studies that it's very therapeutic for a patient to be able to express their gratitude. And we're not actually allowing them to fully recover if they don't have an opportunity to share their gratitude. And, I think of one patient, for example, that really realized that their life had been saved through the great emergency care that our team provided. And I know there's hundreds of those cases in just the last few years within our community that healthcare has saved many, many lives. And it's so wonderful when a patient actually recognizes that. It's therapeutic for them to acknowledge it. And then part B, it was so special and humbling to see the person make a financial donation after, for example, they received a COVID-19 vaccine. And I think of another patient who said that the two best days of her life was number one, 50 years ago when she got married. And the second day was recently, the 2 days she got her vaccine for COVID-19. And so that's humbling to hear the importance and the impact we have on our community's health and safety.
Harry, you can't possibly see all of the responses that the system receives, but do you see some of the responses, and is there a repetitive theme that you observe?
I do see many of them, and they're varied for all types of illnesses and injuries, and the unbelievable gratitude and kindness. It is really spirit lifting for our team. It's therapeutic for our clinical team to hear that, and it just makes us feel so grateful that we are here to save the lives of these patients. And we believe with a a grateful patient program or any patient health system connected program, that we believe there's this deep fundamental desire or belief, and that is that they wish for great health care to always be here. They want to see an ever strengthening guarantee that great health care is always going to be here year after year to protect their life and the lives of their loved ones.
Harry, when we were on break, you spoke about 3 pillars that constitute excellent health care. Operations being one, for example. I think that's the one that you began with. Would you share with us those 3 pillars and why that's important to our grateful patients?
Absolutely, and we believe that our performance in the last 5 years has helped us really discuss this 3-pillar concept, and that is pillar number 1 is a great operational platform for the health system, that it needs to be operating in a very strong way. And number 2, the health system does need to borrow occasionally through minimal amounts. It needs to have a very high investment rating so that the rates are low. But then number 3, that's just as important to occasional borrowing or strong operations, is a strong philanthropic support for healthcare. It requires all 3, with the tremendous challenges that we face from payers, which represent regulatory force changes or market force changes, et cetera. It's why it is so critical today to have really all 3. And there's a strong correlation as I look at great health systems out across America. It's like only the very best, in many cases, have the really large companion foundation. And I would respectfully offer that our health system has now moved into that strong operating zone as well, where we are that deserving partner to really partner with our community on the larger scale, like as occurs with many admired hospitals in America today.
Harry, we probably have about 30 seconds left for a question here, but really quickly, how does this have an impact on the caregivers, providers, nurses?
The impact is multifaceted. Number 1, it uplifts their spirit. As humans, they need that nurturing of the thank you and the gratitude for the patient. That's a part of staying whole and alive and healthy as a caregiver. You just can't place enough importance on that.
Well, thank you, Harry. We're going to take a break in just a minute. For those at home, you're watching Mountain Health Today. I'm Ted Owens, your host, and we're talking with Harry Weiss from the Tahoe Forest Health System. We'll be back in just a few moments. Hello and welcome back to Mountain Health Today. I'm Ted Owens, your host. We're talking with Harry Weiss from the Tahoe Forest Health System about the Grateful Patient Program that they've created. And we've been talking about what it means to not only those that provide the care, but those that receive it. Harry, my next question has to do with the support. What does the Grateful Patient Program ultimately support?
The beauty of this program, number 1, the friendships are very inspiring, but number 2, as these grateful patients evolve to also being donors, what we're seeing in very tangible ways is maybe there was some new specific equipment that was provided for us to become a level 3 trauma center one day. For example, maybe it's we have the state-of-the-art 3D mammography equipment that's as good as any tertiary facility in America. And 100 cents of the dollar of every donation that comes from our patients goes for their donor purpose. So there are many foundations out there that a modest to large percentage of the donation has to go just to keep the foundation alive. And because our health system makes sure that the staff are available in each of our foundations, that makes sure that 100% of every donor's dollar goes for the areas that they desire most.
Harry,
And I
isn't
think
it
that's
true,
really
I
special.
hate to interrupt, but isn't it true that the program also develops a great sense of community confidence and enhances immediate access to incredible care in a rural environment? And that's unique, isn't it?
It is, and I think our community has really seen large measurable changes in our health system as we've added equipment, we've added physicians, we've added, for example, mental health programs and so forth. But those kind words and acts by our patients also do something else very special for our community, and that is we're seeing a phenomenally growing number of team members every year that are also donating to our foundations to make sure that this is yet an additional stakeholder group that is donating to make sure that pieces of equipment, building space, programs are available in new and innovative ways for our community. So we're seeing even our team members' participation grow phenomenally over the last several years.
Now, I know that a lot of the support went to, say, the emergency department this last year in spite of COVID. Tell us a little bit about what that support looked like in the ER.
We've had a variety of equipment there in the ER. We've also had financial assistance to help with our large public health efforts. For COVID-19, we've staffed dozens of individuals. We've maintained a registered nurse hotline for more than a year right now. So we've been an unparalleled public health service for our community to really deal with this once in 100-year pandemic. And some of our busiest weeks and months still lie ahead relative to the pandemic. And our team is very courageous. They're going to be working hard with ever larger patient numbers as we seek to try to completely vaccinate every person that wants a vaccine over the next several months, so that hopefully by fall, we've helped families, we've helped businesses, we've helped schools return to normalcy. And we're doing that in addition to just a tremendous number of either physical patient care space or equipment needs that we have presently.
Harry, can you tell me about the Annalise King Hall Fund?
This is a great story of love, where with great regret, there was a stillborn that the family experienced, and rather than be inward focused, they were outward, very benevolent focused. And so they have donated money to our team to help our physicians and our staff cope with such a loss of a stillborn, and also how to help other families that might experience such an event. These events happen very, very rarely, but what a kind, loving act to take such an event and help our team and help other families. And this really goes to even the founding story of Dick Joseph, when he had an avoidable tragedy where his wife passed away as they were driving to deliver twins because there wasn't local health care. And he gave so much that allowed healthcare to begin here in Truckee in a vigorous way.
And so the legacy has definitely lived on. Harry, we only have about 20 seconds. Can you tell us where people can give or find out more about the Grateful Patient
Yes,
Program?
please go to our tfhd.com website you go to ask questions, you could type in grateful patient giving form, and you can tell your story. And if you so choose, you'd like to donate, we'd be happy to hear your story. And 100 cents on the dollar of your thoughtful gift will be used to the
Perfect.
purpose you intend. Thank you.
Thank you, Harry. We've been talking with Harry Weiss from the Tahoe Forest Health System, and you've been watching Mountain Health Today. Thank you so much for joining us.